Welcome back, honorable delegates. And I sincerely hope you've had a brief rest and a nice lunch. I believe for the very first time in our meeting this week, we're starting on Fiji time. So, congratulations. We should return now to the questions of credentials of the representatives of the members and territories participating in this regional committee meeting. Further, to the report of the officers on credentials and the subsequent decision on the regional committee this morning, I can inform you that in addition to the credentials already approved, credentials have also been received from the Commonwealth of the Northern Mariana Islands, one of the United States of America territories in the Western Pacific. The credentials submitted by the Commonwealth of the North Mariana Islands have been reviewed by the Secretariat and found to conform with the relevant rules. I therefore propose that the Regional Committee recognize their validity. Is there any objection to this? I see none. It is so decided. Moving on. We now move to agenda item 11. Implementing the International Health Regulations 2005 Amendments, document WPR/RC76/5. And may I invite the Regional Director to introduce this item.
Thank you, Chair. Distinguished representatives, I am pleased to present for your consideration document WPR/RC76/5 on implementing the International Health Regulations 2005 amendments. The International Health Regulation 2005, or IHR, is a legally binding global framework intended to prevent, detect, notify and respond to transport public health threats. In all, 196 states parties, including all WHO member states, are bound by these regulations. Following the COVID-19 pandemic, member states worked with unprecedented resolve to strengthen global health security architecture, leading to two landmark agreements. One, adopting targeted amendments to IHR, and the other, adopting the WHO Pandemic Agreement. The IHR amendments, which began entering into force on the 19th September 2025, introduced important new obligations for states parties, including the designation of a national coordinating mechanism or a national IHR authority to coordinate implementation of the IHR and the enhancement of multi-sectoral capacities. The IHR amendments were adopted at the World Health Assembly in 2024, and the WHO Pandemic Agreement was adopted earlier this year by the Health Assembly. Together, they offer a once-in-a-generation opportunity to embed equity, solidarity, and operational readiness across the Western Pacific region and globally. States must give serious consideration to what the region can do to better prepare for future health emergencies, including strengthening coordination, improving surveillance, and ensuring timely access to medical countermeasures. By implementing the IHR amendments and the WHO Pandemic Agreement through a coherent, collaborative approach, member states can greatly enhance the region's collective ability to launch and sustain operational responses to future public health emergencies and pandemics. The Regional Committee is invited to consider for endorsement the draft plan implementing the International Health Regulation 2005 amendments in the Western Pacific region. Thank you, Chair.
Thank you, Dr. Pukala. And I understand the Secretariat has prepared a video in this item. Can we please play this video?
So the International Health Regulations 2005 have absolutely stood the test of time. They're like a superpower for countries in combating infectious diseases. The amendments that we all agreed in June 2024 take on board the lessons from the COVID-19 pandemic to allow us to better prevent, prepare for and respond to infectious disease outbreaks and future pandemics. A number of the amendments are about what we would do collectively, but each country is also required to strengthen their surveillance systems so that they are absolutely detecting infectious disease outbreaks early. They need to make sure they are reporting in a timely manner, and countries also need to establish or designate a national IHR authority. Countries across the Western Pacific region mounted some of the best responses to the COVID-19 pandemic. And when the IHR were being amended, countries from our region were active participants. We need to work closely together to fully implement the amended international health regulations and to support the leadership role that the World Health Organization has both globally and regionally. We are stronger together.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. And for the second time, I call on the representative of Singapore to be followed by Malaysia. Congratulations, Singapore.
Thank you very much, Chair. Singapore supports W.H.O's draft on implementing the IHR amendments in the Western Pacific region. Just 1 month ago, on 19th September, the IHR amendments entered into force, marking the culmination of an extraordinary 3-year journey. Since 2022, all member states have worked tirelessly, united by a single imperative: learning from COVID-19 to build stronger defenses against future pandemics. This achievement belongs to all member states and Secretariat, but Singapore wishes to particularly acknowledge our region's leadership under Sir Ashley Bloomfield's leadership as co-chair of the Working Group on Amendments to the International Health Regulations 2005 Bureau. Our Western Pacific region has shown what collaborative determination can accomplish. Yet as we celebrate this milestone, we recognize that our real work begins now. W.H.O has demonstrated remarkable foresight in developing the Asia-Pacific Health Security Action Framework, APHSEF. This isn't just another document. It's our roadmap for turning commitments into capabilities. APHSEF will strengthen our operational readiness across the entire value chain, from surveillance systems that detect threats early to emergency coordination that responds swiftly to clinical care that saves lives and community protection that keeps our people safe. Singapore endorses the priority actions outlined in this plan. We particularly support the proposal for regional technical consultations because honest assessment of current capacities is the foundation for improvement. In Singapore, we've taken steps by designating our newly formed Communicable Diseases Agency as our national IHR authority. This institution will coordinate our whole-of-government response through our Singapore Pandemic Preparedness and Response Framework launched this year. But national preparedness alone is insufficient. Pathogens don't respect borders, and neither can our response. Regional collaboration isn't just beneficial, it's essential for our collective security. We look forward to working with W.H.O and all members through the upcoming States Parties Committee to transform these amendments from words on paper into the robust health security our region deserves. Thank you.
I call on the representative of Malaysia to be followed by Philippines.
Thank you, Chair. Malaysia views the recent amendments as critical enhancement, particularly the explicit inclusion of preparedness within the IHR scope, the introduction of the new alert levels of pandemic emergency, and the strengthened provision for equitable access to countermeasures. Guided by this revision and the Asia-Pacific Health Security Action Framework 2024, Malaysia has developed the National Action Plan for Health Security 2025-2030 to align with the new IHR requirements. This Malaysia plan adopts a whole-of-government and whole-of-society approach anchored by the amended Prevention and Control of Infectious Disease Act and other relevant Malaysian public health laws. Key priorities include integrated surveillance and early warning system, strengthened laboratory network, enhanced preparedness and response, effective risk communication and workforce development. Malaysia continues to utilize the State Party Annual Report and the Joint External Evaluation as complementary tools to identify gaps, measure progress and prioritize investment in health security. This mechanism provides valuable benchmarks that inform the implementation of Malaysian plan and support alignment with the amended IHR. Malaysia appreciates the inclusion of clear indicators and targets in the draft plan. We emphasize that monitoring and evaluation mechanisms should be facilitative, consultative and context-sensitive, operating in non-adversarial and supportive manner. We also want to take this opportunity to extend our appreciation to W.H.O for having organized webinar session on the National IHR focal point, and we look forward to info session from time to time on these IHR amendments implementation, as it is always beneficial to have a dialogue and exchange thoughts among W.H.O member states on operational levels. Malaysia is fully support the draft implementation plan and endorse its adoption. We look forward to working closely with W.H.O and fellow member states to operationalize the amendments, ensuring that regional health security is robust, resilient, and equitable. Thank you, Chair.
I call on the representative of Philippines to be followed by Solomon Islands.
Thank you, Chair. The Philippines reaffirms its full commitment to the International Health Regulations 2005 and welcomes the 2024 amendments as a vital step towards a more equitable, coordinated and coherent global health security architecture. We appreciate the regional roadmap for the IHR amendments, includes core indicators and targets for its implementation in the next 5 years. These are vital to transparently track progress, identify bottlenecks, and ensure cooperation in strengthening national and regional capacities. We hope to develop a similar regional roadmap for the pandemic agreement. We recognize the amended IHR and the forthcoming WHO pandemic agreement as twin instruments that must be implemented in synergy. In preparation, we have begun updating national legislation to designate a national IHR authority, integrate the new definition of pandemic emergency into our response protocols, and secure whole-of-government engagement, primarily across human, animal, and environmental sectors. Our 2024 joint external evaluation showed substantial progress with most technical areas now at developed or demonstrated capacity. These gains are being institutionalized through our National Action Plan for Health Security financed by domestic investments and supported by the development financing such as the Pandemic Fund and the Health Systems Resilience Project. We highlight our multi-sectoral pandemic fund model, where surveillance systems integration, data analytics, genomic capacity, community-based early detection, and workforce development, including surge capacity plan, are jointly implemented by health, agriculture, environment, and local government sectors. This One Health financing and governance framework is one we stand ready to share with our fellow member states. We thank WHO for its legal implementation toolkits and operational guidance, and we echo the call for coordinated regional implementation through the Asia-Pacific Health Security Action Framework. The Philippines stands ready to contribute actively to regional consultations, particularly in laboratory integration, surge workforce models, and shared logistics and supply chain mechanisms to strengthen collective operational readiness. Thank you, Mr. Chair.
Thank you. A call on the representative of Solomon Islands, to be followed by Indonesia.
Chair, fellow ministers, distinguished delegates, Solomon Islands warmly welcomes the draft implementation plan for the International Health Regulation 2025 amendments and strongly endorses the coordinated regional approach outlined in the document WPRS/RC76/5. We recognize that these amendments represent a transformative opportunity to strengthen our national health security architecture. Solomon Islands has demonstrated an unwavering commitment to implementing international health regulation core capacities. Last year, we completed our first joint external evaluation engaging stakeholders from multiple ministries and sectors. Building on the joint external evaluation findings, we conducted our first national risk profiling and emergency workforce mapping in April this year using the WHO methodology and bringing together participants from health, environment, security, justice sectors to prioritize health risks. We conclude in our annual operational plan that the development of our first hosted multi-sectoral national action plan for health security aligned with the International Health Regulation 2025 assessment outcomes to guide future investment and strengthen our international health regulation core capacities. We are advancing preparation for designating Munda International Airport in the Western Province as our fourth point of entry, thereby strengthening our border health security capacity in a province with critical international connectivity. In addition, in August, we conducted a provincial emergency preparedness and response training addressing JEE-identified gaps in provincial operational readiness and workforce surge capacity. Our commitment extends beyond national level planning to concrete operational readiness at provincial level. Chair, recognizing that robust civilian systems are fundamental to early detection and rapid response, Solomon Islands have undertaken twice this year's initiatives that bring together health, agriculture, environment, disaster management, biosecurity, and border control sectors to systematically map the existing civilian systems and develop a collaborative civilian roadmap that integrates human, animal, and environmental health data through a One Health approach. Multi-sectoral coordination meetings are now embedded in our annual operational plan to ensure sustainability and continuous improvement of our early detection and response capabilities. Directly implementing IHR core capacity requirements for civilians and information sharing. Solomon Islands fully support the priority action outlined in the implementation plan. We are committed to designating our national international health regulation authority, integrating the pandemic emergency definition into our national preparedness plans, and strengthening our multi-sectoral coordination mechanisms through our One Health Coordination Committee. We appreciate WHO technical support through the Asia Pacific Health Security Action Framework platform and look forward to actively contributing to regional technical consultation to identify and implement measures that strengthen our collective operational readiness. With the International Health Regulation Amendment, Solomon Islands believes that we will work together far stronger in achieving our regional, national, communities' health outcome desired by our people and our children. Thank you, Chairman and Vinaka.
Thank you. I call on the representative of Indonesia to be followed by the Republic of Korea.
Thank you, Chair. Indonesia welcomed the adoption of the amendment to the International Health Regulation in 2024, as well as the historic adoption of the WHO Pandemic Agreement in 2025. This landmark development represents our collective resolve to build a safer, fairer, and more resilient global health architecture. We remain deeply committed to working collaboratively on the negotiation of the Annex on Pathogen Access and Benefit Sharing, which Indonesia regards as the beating heart of the pandemic agreement. Indonesia strongly supports the effective implementation of the amended IHR and welcome the adoption of the implementation plan, which outline priority action for countries in the Western Pacific region. We believe this plan will serve as a vital roadmap to operationalize the amended IHR in accordance with the principle of resilience, equity, and solidarity. In line with this commitment, Indonesia has conducted joint external evaluation in 2017 and 2023, and is in the process of updating our National Action Plan for Health Security to incorporate the key recommendations from the evaluation. Finally, Indonesia calls upon our W.H.O family to continue fostering mutual learning and exchange of best practice so that the valuable lessons from past crises may guide us toward building stronger, more coordinated, and more resilient health system for the benefit of all. Thank you, sir.
Thank you. I call on the representative of Republic of Korea to be followed by Brunei Darussalam.
Distinguished Chair, the Republic of Korea would like to express our deep appreciation to the W.H.O Secretariat for its unwavering leadership and ongoing support in advancing implementation of the international health regulations and reinforcing our collective commitment to health security throughout the region. The Republic of Korea reaffirms its strong commitment to the full and timely implementation of the IHR, including the recent 2024 amendments, recognizing these as pivotal in building a more resilient, equitable, and effective global health security system. Korea acknowledges the urgency in strengthening multi-sectoral coordination and operational readiness in the face of increasingly complex health emergencies, and will actively engage in regional and global efforts in line with current frameworks and strategies. To this end, the Republic of Korea fully supports the W.H.O Secretariat's proposed document on implementing the amended IHR in the Western Pacific region. Korea will work constructively with the Secretariat and Member States to realize the vision and actions set forth in the document, further reinforcing mutual accountability and regional solidarity for health security. We urge W.H.O Member States to do the same. In August of this year, the Republic of Korea had received its second joint external evaluation, and it was an opportunity to reaffirm Korea's robust emergency preparedness and response system under the IHR framework. We stand ready to share our experience and know-hows with other member states and states parties to support IHR's core capacity strengthening across the region. Regards to the implementation of the amended IHR, consultations are currently underway for the designation of the National IHR Authority, with a commitment to complete the designation by the end of this year. We believe this is a critical step to further enhance our whole-of-government coordination and multi-sectoral collaboration in IHR implementation. Chair, we remain committed to collaborating closely with the WHO, member states, states parties, and other relevant partners to enhance global health security, advance pandemic preparedness and response, and support the vision of resilient communities and health systems across the Western Pacific region. Thank you.
Thank you. Call on the representative of Brunei Darussalam to be followed by Cambodia.
Thank you, Honorable Chair. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good afternoon. Honorable Chair, Excellencies, ladies and gentlemen, Brunei Darussalam thanks the Secretariat for the comprehensive draft on implementing the IHR amendments. We warmly welcome this roadmap and affirm our strong commitment to advancing health security across the Western Pacific. Over the years, Brunei Darussalam has made steady progress in implementing the IHR, including establishing a national IHR implementation committee to provide multi-sectoral oversight, strengthening the Emergency Operations Center, and conducting national preparedness exercises. In 2019, we took the joint external evaluation with a follow-up plan to assess progress and gaps. We have also strengthened national surveillance capacities in line with the IHR amendments, using digital platforms such as BruHealth to enhance real-time monitoring and coordination during public health events. Building on these foundations, Brunei Darussalam has recently designated a national IHR authority in full alignment with the amendments to coordinate and strengthen implementation at the national level. In line with the IHR amendments, emphasis on multi-sectoral collaboration and risk assessment, Brunei Darussalam has conducted a national bridging workshop with support from the quadripartite. In the coming months, we will also convene a One Health Zoonotic Disease Prioritization Workshop and a National Risk Assessment Workshop. These initiatives reinforce our commitment to a whole-of-nation and One Health approach. Despite these achievements, we recognize areas where further WHO support would be valuable, including guidance on translating the amendments into actionable policies, strengthening surge capacity, and operationalizing JEE recommendations. We take this opportunity to sincerely thank WHO for its continued technical support, which has been instrumental in advancing our progress. Brunei Darussalam looks forward to working closely with WHO and member states to fully implement the IHR amendments and strengthen health security for all. Thank you.
Thank you. Call on the representative of Cambodia to be followed by New Caledonia, France.
Honorable Chairs, Cambodia highly appreciates the Secretariat for drafting the implementation plan for the International Regulation W.H.O 2005 amendment in the Western Pacific regions. We note that the draft implementation plan is in line with W.H.O 2005 amendment adopted at the World Health Assembly in 2024 and the WHO Pandemic Agreement adopted at the WHO this year. It is also aligned with our regional vision and the Asia-Pacific Health and Security Action Frameworks. Cambodia fully supports the draft implementation plan for the WHO 2005 amendment in the Western Pacific regions. This implementation plan guides the current work in Cambodia, mainly the development of the new respiratory pathogen pandemic preparedness and response. The plan is drafted with using the WHO preparedness and resilient for emergency threat approach, incorporating the 5 Cs and aligned with the Asia-Pacific Health Security Action Frameworks. And the update of the Cambodian National Action Plan for the Health Security 2025-2027 to continue strengthening WHO capacity to prepare for and respond to emerging disease and the public health emergencies. These national plans are developed based on the key recommendations, focus on strengthening operational readiness, human resource, laboratory system, sustainable financing, and institutional leadership and the governance and health authorities, as informed by a critical multi-sectoral collaboration process for the WHO core capacity assessment This includes, first, the second joint electoral evaluation (JEE) of IHR 2005 core capacity conducted in 2023. Second, the annual review of the IHR state party cell assessment conducted in January 2025 with the participation of the 19 ministries and 9 partners. Third, an all-hazard national strategic reassessment in 2024 using the strategic tool for assessment risk, STAR, to develop an all-hazard country risk profile. Collectively, 40 multi-sectoral experts from health, disaster management, animal health, climate, environment, security agency, partner, and civil society organizations. Cambodia are looking forward to working closely with the WHO, member states, and partners, including private sector, to put the plan in implementation. I thank Excellency Chairs.
Thank you. Call on the representative of New Caledonia, France, to be followed by Papua New Guinea.
Thank you, Chair. New Caledonia would like to thank the Secretariat for this outstanding report on the work conducted to develop the amendments to the international health regulations. New Caledonia contributed to the work in question in the region as a focal point, as a local focal point located in metropolitan France. These meetings highlighted the importance of a collaborative approach to stabilize the economies and protect our communities. New Caledonia is therefore in favor of the urgent implementation of the new amendments because they will strengthen prevention, preparation and resilience in case of a pandemic, and they will promote solidarity and equity in health security. New Caledonia also supports the wish expressed by member countries to set up a regional forum to improve our operational capacities in case of a pandemic in the Western Pacific region, using existing models in other regions of the world. This is to make sure that no country is ever left behind in such health emergencies. Thank you very much.
Thank you. I now call on the representative of Papua New Guinea to be followed by Australia.
Thank you, Honourable Chair. Papua New Guinea welcomes and commends the WHO and member states for the collective progress in advancing global health security through the 2024 amendments to the International Health Regulation. The adoption of these amendments at the 77th World Health Assembly represents a historic step in ensuring our region is better prepared to prevent, detect, and to respond to health emergencies on an equitable, coordinated, and resilient manner. Papua New Guinea fully supports the revised IHR provisions, particularly the establishment of national IHR authorities, the strengthened focus on equity, solidarity, and the One Health, and the introduction of pandemic emergency classification. This reflects our shared commitment to safeguarding population through collective preparedness. At the national level, Papua New Guinea continues to strengthen its health security and preparedness architecture in alignment with these global reforms. We are finalizing the designation of a national IHR authority and reviewing public health legislation to ensure full compliance with the amendment regulations. In June this year, our Parliament passed the Papua New Guinea Biosecurity Act of 2025, a landmark law that unifies and modifies our biosecurity framework. The Act enhances our ability to manage biosecurity risks, protect against transboundary threats, and ensure alignment with the international trade standards and the international health regulations. Papua New Guinea continues to champion multi-sectoral collaboration as the foundation of health security. In this regard, we proudly hosted the first civil-military collaboration for health security exercise in the region, followed by Indo-Pacific Health Security Alliance meeting in May this year. These initiatives have strengthened the interface between civilian and defense sectors and to reaffirm the importance of cross-sectoral coordination in health emergency response and preparedness and response. Our commitment in the health approach remains strong. This was demonstrated at the 2025 National Medical Symposium, where experts from National Department of Agriculture and Livestock and other key sectors jointly presented a zoonotic disease prevention and surveillance. Papua New Guinea reaffirms the climate change, that climate change, biosecurity, and emergency infections diseases are interconnected threats priorities. We therefore call for the continued regional solidarity under the Asia-Pacific Health Security Action Framework and equitable access to resources under forthcoming pandemic agreement. Thank you, Chair.
Thank you. I call on the representative of Australia to be followed by Vietnam.
Thank you, Chair. Implementation of the IHR amendments heralds a new era for health emergency preparedness and response, and we congratulate the regional officers' proactivity in supporting its implementation. Enhanced coordination and cooperation on health security will deliver more agile and resilient health emergency prevention, preparedness and response for our region. Australia is in a strong position to implement the IHR amendments. We were pleased to notify the RD in September that our Health Minister, Mark Butler, has designated the Australian Department of Health, Disability and Ageing as our national IHR authority. This step builds on the department's well-established role in overseeing our health emergency management arrangements and coordination of Australia's implementation of the IHR core capacities. It is with enthusiasm Australia endorses the draft IHR implementation plan. We also welcome the priority implementation actions for member states. We acknowledge the critical role of the WHO Secretariat's ongoing technical assistance, including to support the strengthened IHR core capacities of member states. In doing so, we encourage the Secretariat to take account of the diversity of our region, responding with fit-for-purpose actions that meet our health emergency readiness requirements. We also support member state engagement through the Asia-Pacific Health Security Action Framework. It is essential that we exchange our experiences and identify further opportunities to strengthen the region's operational readiness for future health emergencies. We recognise the achievement of all member states in the region, submitting the state parties' self-assessment annual report and the important outcomes produced through the joint external evaluations. We encourage this strong track record of engagement continuing as we implement the IHR amendments. Thank you, Chair.
Thank you. I call upon the representative of Vietnam to be followed by China.
Thank you, Chair. Vietnam is pleased to acknowledge the draft plan for implementing the IHA 2005 amended in the Western Pacific region, which outline priority actions towards strengthening regional operation with realized needs for public health emergency in the regions. At the same time, Vietnam expressed its high appreciation for the WHO's efforts in reviewing and amending in the IHR to better equip countries and global community to respond to future health emergencies. Vietnam wishes to make some general observation and comment on the draft plan as follows. First, we fully agree with the detailed activity proposed in the draft plan that help strengthening regional and national needs for public health emergencies, and in line with the IHR amended, which confirm the importance of multi-sectoral One Health approach and whole of government engagement in global health security is the principle of solidarity and equity. We call for WHO's continued technical and financial support for countries, particularly developing countries in the region, to build and sustain core IHR capacities and implement in the IHR amended to prepare, detect, notify, report and respond rapidly to health emergencies. Secondly, regarding the designation of the National IHR Authority to coordinate implementation of the IHR, we agree with the timeline proposed for processing of designating the National IHR Authority without disrupting the function of the IHR and FP. As such, the National IHR Authority should be a new entity which must have mandates and strong empower to effectively coordinate holds the government cross-section action with involvement and guidance by the government cabinet office. The IHR should play as a sub-entity as the authority. We can stress that Vietnam has successfully conducted the second GEE 2025 with big financial and technical support from W.H.O. We are also in final drafting the law of disease prevention and the national targets program on health in the way of taking advantage of the GEE recommendation and IHR. Amended into account research priority activity as improving financial mechanism for disease prevention and emergency response, promoting multi-sectoral coordination and collaboration, especially in points of entry, strengthening health workforce development, establishing and empower of the National IHR Authority, legal mandating for biosafety and biosecurity, including mechanism for mobilizing and deploying staff in health emergency in the contingency plan and other. Thank you, Chair.
Thank you. I call upon the representative of China to be followed by Marshall Islands.
Thank you, Mr. Chair. China takes note of the conference document WPR/RC76/5 concerning the implementation of the amendments to IHR. We appreciate and commend the efforts made by the regional office in advancing the coordinated implementation of IHR. Since 2022, China has actively participated in the in-person negotiation of WGHR, playing a constructive role in the adoption of IHR amendments as to the 77th W.H.O. We are confident that after these amendments took effect on September 19 this year, they will further promote state parties' compliance and implementation, strengthen the notification of information for fake, foster core capacity building, and address equity issues in emergency response. China firmly believes that the implementation of IHR should uphold fundamental principles of respecting sovereignty, promoting global solidarity, protecting equity, and enhancing mutual trust. Regarding priority activities, we support the document in general and wish to offer the following recommendations. First, strengthen the regional level early warning and response mechanism. The regional office should, through broader channels, share and communicate regional public health emergency monitoring information and risk assessment results. In case of a potential fake or a potential pandemic identification, the regional office can timely sound early warning via IHR communication mechanism, share information to help countries to prepare early and promptly coordinate and deploy emergency teams to prevent the spread of outbreaks. Second, improve regional IHR communication mechanisms. The regional office should, at the earliest convenience, coordinate the sharing of departmental setup and contact information of national focal points and national competent authorities, and provide technical training on the implementation of the amendments to assist the state parties' understanding and implementation. Third, enhance support for national core capacity building, particularly in building health emergency teams and developing surveillance capabilities. We can make use of WHO collaborating centers to have collaborative research and development of pandemic-related health products, the establishment of a regional-level distribution network for such products, thereby advancing equitable access to pandemic supplies in the region. China is ready to support the regional office and member states to step up their response mechanism to emergencies and to enhance capacity building. Let's pull together to ensure the practical and effective implementation of the newly amended regulations, fulfilling our historical mission of safeguarding global health security. Thank you, Chair.
Thank you. I call upon the representative of Marshall Islands to be followed by Japan.
Thank you, Honorable Chair. The adoption of 2024 amendments to the International Air Regulation represent a pivotal step in strengthening global and regional air security. These amendments provide an essential framework to enhance national capacities, reinforce preparedness, and protect the health of over 2.2 billion people in the Western Pacific region. The COVID-19 pandemic and other region public health emergencies have underscored the region's need for rapid, coordinated, and equitable responses. Implementing the IHR amendments alongside preparation for the new WHO pandemic agreement is critical to closing capacity gaps, ensuring timely access to information and resources, and building resilient health systems capable of responding effectively to emerging threats. The Marshall Islands remains fully committed to this effort. We completed our large joint external evaluation in 2019, continue to submit the State Party annual report each year, and conduct regular simulation exercises, including the Crystal exercise. Our national emergency response is further strengthened by the Marshall Island medical assistance teams, who play a crucial role during the COVID-19 response and continue to respond to public health emergencies across the country and neighboring islands. These measures are vital for assessing capacities, identifying gaps, and guiding continuous improvements within our health sector. For our country and across the region, these amendments align closely with the vision of weaving health for families, communities, and societies. By strengthening our health security architecture, we safeguard health, support broader development, and reinforce regional cohesion. The Marshall Islands stand ready to actively contribute to the implementation of IHR amendments, working closely with WHO and other regional partners. Through sustained collaboration, mutually accountability, and solidarity, member states of the Western Pacific can build a health security system that is equitable, resilient, and agile, one that serves as a model for inclusive and forward-looking public health action. I thank you, Chair.
Thank you. I call upon the representative of Japan to be followed by Hong Kong Special Administrative Region, China.
Chair, strengthening prevention, preparedness, and response to health emergencies remains critically important in our region. Japan appreciates the Secretariat's continued support in this area and intends to maintain our contribution, particularly towards enhancing infectious disease response capacities in the Western Pacific region. We welcome the implementation plan aimed at strengthening core capacities under the international health regulations, which remains a priority for many member states. Japan also remains committed to working closely with other member states to enhance PPR for future health emergencies. I'd like to make one point from the perspective of accuracy. In the session documents, the phrase key entities and mechanisms established under the WHO pandemic agreement is used. Since the WHO pandemic agreement has yet to enter into force, we propose established to be replaced with to be established. Regarding the third call for proposals under the pandemic fund, Japan recognizes the importance of multi-country proposals from the Western Pacific region and has provided support to the Secretariat accordingly. We believe such opportunities should be actively utilized to further strengthen regional PPR efforts. Japan remains committed to contributing to regional health security and encourages continued collaboration with other member states and the Secretariat in this area. Thank you, Chair.
Thank you. I call upon the representative of Hong Kong Special Administrative Region, China.
Thank you, Chair. Hong Kong, China congratulates the effort of WHO in passing the IHR amendments, and we are pleased to join with our fellow member states in endorsing the regional office plan on implementing these amendments. The IHR amendments underscore the importance of multi-sectoral, One Health, and whole-of-government engagement in global health security, and we fully concur with the priority actions for strengthening the regional readiness and resilience. Hong Kong, China has been actively involved in the platforms and also networks under the Asia-Pacific Security Action Framework. We also actively participate in the IHR exercises. For example, the IHR exercise Crystal organized last year to sharpen our risk communication strategies. As robust genomic sequencing capacity can allow us to rapidly identify the origin and spread of pathogens and to timely contain such outbreaks at an early stage, Hong Kong, China also stands ready to share our expertise and provide testing support to fellow member states via the WHO established networks and platforms as our joint effort under the solidarity and equity principles for global health security. Hong Kong, China also recommends the W.H.O can consider in future develop and utilize innovative and smart technologies such as AI to assist in pandemic and epidemic information sharing in the region. And also, through the established network and platform, consider setting up stockpiles of critical resources so equitable sharing of resources to combat such pandemics or epidemics in the region can be possible. In closing, Hong Kong, China reaffirms our commitment to the IHR. We will sustain momentum in enhancing our public health capacities and join regional partners to advance global health security targets. I thank you, Chair.
Thank you. I call upon the representative of the Federated States of Micronesia to be followed by Fiji.
Thank you, Chair. The Federated States of Micronesia appreciates the report on implementing the IHR in the Western Pacific region. We recognize the importance of ensuring that IHR remain responsive and relevant, particularly in light of the recently endorsed pandemic agreement. FSM supports the proposed plan of work outlined in the report and acknowledges the efforts to facilitate member states' preparedness. As the IHRs are legally binding, we underscore that implementation of any amendments remains subject to national legislative and regulatory processes, and we look forward to ensuring that the regulations with these amendments respond effectively to current and future health challenges. Thank you.
Thank you. I call upon the representative of Fiji.
Honorable Chair, distinguished members of the Forum, Fiji actively engaged in negotiations for the amendments to the International Health Regulation 2005 from November 2022 until the adoption of the amended IHR on the final day of the 77th World Health Assembly on June the 1st, 2024. Our focus during the negotiation was to produce an amended IHR that, together with the pandemic agreement, provide instruments of international law that enables more equitable preparedness and response for the next pandemic while maintaining our national sovereignty. With the entry into force of the amendment IHR on September 19th this year, the success of the amendment will depend on their implementation by us and the state parties of the IHR as well as the Secretariat of the W.H.O. Therefore, Fiji commends the Western Pacific Regional Office of the W.H.O. for rapidly moving forward with coordinated implementation through the draft implementation plan presented in this agenda item titled Implementing the International Health Regulation 2005 Amendment in the Western Pacific region. Within the implementation plan, we agree with the priority action for member states, including the core indicators, which include genomic sequencing capacity. With the support of partners, including WHO, Fiji officially opened the pathogen genomic laboratory at the Fiji Center for Disease Control of Fiji CDC earlier this year, thereby establishing our national capacity for genomic sequencing of priority pathogens and contributing to regional capacity for the Pacific. In addition to the individual member states' priority actions in the IHR implementation plan, we also urge equal focus on identifying priority measures to improve regional collective readiness for public health emergencies. It is this section of the plan that has the potential to address equity in the amended IHR through global and regional solidarity, including through linking with global mechanisms established under the amended IHR and the pandemic agreement, such as the coordinating financial mechanism and the global supply chain and logistic network. As outlined in the implementation plan, we agree that assessing existing capacities and systems and identifying and supporting further measures to improve collective readiness is a logical first step, and this is particularly important for equitable access to relevant health products during health emergencies in our region. Fiji looks forward to future update on the IHR amendments implementation plan in this forum, and we support its endorsement, and I thank you, Chair.
Thank you. Are there any more representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. It is therefore my pleasure to ask the representatives of the International Council of Nurses to deliver a statement to the Regional Committee.
Good afternoon, Mr. Chair. The Honorable Minister, Dr. Ratu Atenya Rambiti Lalambalavu. Congratulations to the new position. Good afternoon, the WHO Regional Director, Dr. Saya Piokala, and good afternoon to the distinguished representatives. I am Mila Karen Sarwakawalu, the President of the Fiji Nursing Association and representing the International Council of Nurses. The Honorable Chair, allow me to acknowledge the traditional owners of the current, the past, and the future of this land. I would like to take this time to acknowledge the Regional Director, Dr. Pio Kula, and his Secretariat staff in allowing the ICN to participate in this important meeting. Sincerely acknowledge the Honorable Minister, Dr. Lalambalavu, the Fiji Permanent Secretary for Health, Dr. Chemesa Tunrabu, the Chief Nursing and Midwifery Officer, Mrs. Colleen Wilson, and the Senior Fiji Minister of Health executive leaders for allowing the official release of myself as the Director of Nursing of the only mental health hospital in Fiji to take official release instead of taking leave for this meeting. I would like to register the apology of the ICN CEO, Mr. Howard Quayton, when he's absent. As the culture of the ICN, when it's held in a regional country meeting, the host country, National Nursing Association President, will represent the ICN. Honorable Chair, the item number 11 that I'm going to deliver today on behalf of the ICN. The International Council of Nurses welcomes the adoption of the International Health Regulation 2005 amendments, alongside the WHO Pandemic Agreement, as critical milestone toward a coordinated, equity-driven global health security framework. We support the Western Pacific region's commitment to the weaving health vision and commend the Western Pacific Regional Office leadership in operationalizing this commitment through the Asian Pacific Health Security Framework. Nurses are essential to health emergency response, yet they remain underrepresented in some of the preparedness planning. ICN urges member states to ensure that nurses, including chief nursing officers, are resourced and empowered to shape national high-HR implementation. The resignation of national high-HR authorities must include clear representation from nursing leadership, but I believe some of the Pacific Islands acknowledge the presence of the nursing leaders in terms of the area of health emergency. The ICN's core competencies in disaster, providing a globally relevant foundation for surge workforce readiness. These competencies are essential for embedding nursing capacity into mechanisms such as emergency medical team, as maybe we have experience with some of the Pacific Islands, for example, Fiji. There may be one of the room called the FIMET. We stress that pandemic preparedness financing must extend beyond system to reach the workforce. Directly investment must support nursing education, retention, and safety, especially in low and middle income countries where shortages are more severe. The ICN 2024 International Nurses Day Report and the WHO State of the World Nursing Report 2025 confirm that this investment yields not only resilience but economic future returns. Protection of health workers must be guaranteed. The WHO Health Emergency Response and Resilience Framework for strengthening health emergency prevention, preparedness, response, and resilience rightly identifies the need to protect health workers. ICN calls on member states to ensure the development and integration of safety-focused legislation, policies, and standards aimed to protect health workers. So this includes providing health workers with the necessary resources to undertake their work safely and efficiently. In sum, Honorable Chair, the implementation of the IHR amendments will only succeed if they are embedded and elevate the role of nurses. A future-ready health security system must place nurses at the decision-making table, not only as the front lines. The ICN will continue to go along with the regional so that we further the regional priorities. Let me conclude by a quote on the importance of stakeholders from an American politician in 2013, a lawyer by profession. Her name is Elizabeth Warren. I quote, "It's a simple idea. We can do better when we work together and invest in our future." Unquote. Congratulations to Fiji and Papua New Guinea for the successful elimination of trachoma and other Pacific Island countries with rubella and measles. Thank you. God bless us all.
Thank you for that statement, Lord Milley, from the representative of the International Council of Nurses. May I now call on the representative of the International Federation of Pharmaceutical Manufacturers and Association to deliver the next statement to the Regional Committee.
Thank you very much, Chair. We commend W.H.O for its engagement to develop priority actions for countries and areas in the region to utilize the amended IHR to strengthen regional operational readiness for public health emergencies and promote resilience, equity, and solidarity. As the implementation of the IHR amendments move forward and preparations for the WHO pandemic agreement continue, it is essential to maintain a coherent and inclusive approach. In particular, we emphasize the importance of allowing the INB and the IGWIG to complete their work, especially on the PABS Annex, before introducing new actions. Multi-stakeholder engagement at the regional level will be absolutely critical to ensure that future frameworks are practical, innovation-friendly, and aligned with the realities of public health response. The biopharmaceutical industry stands ready to contribute its expertise, and we encourage continued dialogue and collaboration to ensure that the Western Pacific region remains a model for inclusive, forward-looking pandemic preparedness and response.
Thank you very much. May I now call on the Secretary to respond to the points that have been made.
Thank you, Chair. Thank you, distinguished delegates, honorable ministers. Thank you for the inputs. Sincere thanks for the support and general endorsement of the plan. We hear statements of commitment and intent to move this body of work forward together. We thank you. A number of delegates spoke about the implementation plan's indicators and targets. I am happy to report that the Western Pacific region is the first region to consider measurable targets for implementing the amendments to the IHR. Our region has a strong, long history of championing health security. It has been inspiring to hear delegates share stories and inputs about the impressive work being done in this area. Countries are already advancing the implementation of the IHR, including the amendments we heard about updating of pandemic plans, designation of national IHR authorities, and strengthening multi-sectoral coordination, including through a One Health lens. We welcome the recommendations on how to strengthen regional readiness, be it through digital solutions, strengthening early warning, alert and response systems and notifications, and bespoke support to member states based on needs and context. Hearing this will guide the direction of travel as we conduct an assessment of the landscape to then advance the regional operational readiness. With this, we acknowledge the importance and affirm, of course, that the IHR regulations respecting the implementation is led by each state party in line with its own legal, administrative, and public health structures, while fostering collaboration and mutual accountability to safeguard collective security. With this, Chair, we thank member states for the valuable suggestions. We take on board the strong commitment and intent to move this body of work forward. Thank you.
Thank you very much, Gina. I just wanted to reflect a little bit on the comments from the member states on comparing this topic with the one we had earlier. And it's very interesting to see the nexus or the connections between our work on climate and the work on pandemics. In particular, I think for climate, because of the UNFCCC, we have seen that there are existing multi-sectoral mechanisms and frameworks to guide the work on climate and its health that's trying to find its voice in that existing nexus. And in many cases, national adaptation plans have already been set, have already been done, and health is trying to get into that space. On the other hand, when we're looking at the work on IHR, we're trying to bring the multi-sectoral perspective to work that has been previously mainly in the line of the health sector. And of course, very interesting to hear everybody talking about the One Health lens, which Gina has also mentioned, and how those are all interconnected. I think from a historical point of view, public health didn't have to do this much multi-sectoral work in the past 20 years, but now we have, what should I say, we've come to a point where it is not possible to get any of this work done without a multi-sectoral approach. And I guess in bigger countries and in smaller countries, the approaches would be more nuanced or different. Having said that, multi-sectoral work is critical for both.
And I think that's instructive for us here in WHO. I think listening to these two sessions, it's been very clear that we have to look at more integrated perspectives in our own, among our own ranks, to think about how we can better help you, because the work on both sides is going to be multi-sectoral. In particular, what I thought was that the expertise in these two areas, in climate and in the IHR, is at a nascent stage. In short, those who have been trained in public health or who have done work even in infectious disease or environmental health still need to move a notch upward to try to get to a point where we can look at the complexity and at the same time have the skills to do multi-sectoral mobilization. And that word mobilization is very important. So I was just going to say that for those member states that have more experience in that field, that should be something that we in the Secretariat would be willing to learn from. I'm sure collaborating centers in your different countries may have more tools for other countries that are just starting. But it's been very instructive to hear from all of you on how you are looking at climate, pandemic preparedness, and One Health. Thank you very much.
Thank you very much for information, Dr. Saman, Dr. Mercado, and the introduction of this agenda item, Dr. Pukal. There are no further comments. May I request the rapporteurs to draft an appropriate resolution. And that concludes our consideration on this agenda item. And thank you very much for your contribution. And it is now time for coffee break. Plenary session will reconvene at 3:40 p.m. or 20 to 4. Thank you very much. Bulubinaka, once again, welcome back. We will now have a mobility break. And may I ask everyone to be upstanding for this exercise and join Mr. Luque. And Luque will lead us in this mobility break.
Can we stand, please? For all the liaison officers who are here, can they also come and join me on the stage? Liaison officers? This video we are going to imitate is part of the Let's Move Fiji campaign. In addition to what was discussed yesterday, it was to make all Fijians to be physically active as part of the campaign to adopt healthier lifestyles. So come and join me. And the music we're going to play, it's in Hindi, that coincides with Diwali public holiday today in Fiji. Are we ready? Are we ready? Thank you. Let's play the music.
We now move to agenda item 12, oral health document WPR/RC76/6. And may I invite the regional director to introduce this item.
Thank you, Chair, distinguished representatives. I'm pleased to present to you for your consideration document WPR/RC76/6 on oral health. Oral health is, of course, an integral part of our everyday life, enabling us to eat, speak, smile, learn, and work throughout our lives. Despite the importance of oral health, oral diseases, including dental caries, periodontal diseases, tooth loss, and oral cancer, continue to seriously affect people globally and across the Western Pacific region. In fact, oral diseases are the most common non-communicable diseases in the Western Pacific region, affecting more than 800 million people. That is over 40% of the population. The World Health Assembly addressed this issue last year with the adoption of Global Strategy and Action Plan on Oral Health 2023-2030. Later that year, the Regional Committee called on Member States to take action on oral health in 3 priority areas. First, the integration of oral health into primary health care. Second, the promotion of lifelong oral health. And lastly, strengthening governance and research for oral health, including the development of national policies and strategies. In response, WHO consulted with member states and other stakeholders to develop the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. The Regional Implementation Plan is aligned with the Bangkok Declaration on Oral Health and the regional vision, weaving health for families, communities, and societies. The plan proposes acceleration projects, targets, and milestones to drive progress toward universal health coverage for oral health by 2030. The Regional Committee is invited to consider for endorsement the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. Thank you, Chair.
Thank you, Dr. Pukala. I understand the Secretariat has prepared a video on this item. And can we please play the video? Thank you.
Countries are moving prevention and promotion into places people already get care. In Cambodia, dental nurses apply fluoride varnish during routine vaccination visit. In the Philippines, daily supervised school tooth brushing prevents up to 38% of cavities. At the same time, governments are including essential oral services in primary health care and universal health coverage benefit packages. And Malaysia's national plan embeds oral health across non-communicable disease, PHC and UHC with measurable gains. Learning from these examples and the WHO evidence-based guidance, the region is advancing 5 accelerators to scale what works. WHO anchors oral health in primary health care and universal health coverage, bringing leaders together and aligning plans with the regional and global guidance. Technical support includes policy and workforce development, task sharing, and currently training toolkit for primary healthcare workers to deliver priority essential oral health care is being developed and tested. Countries are also supported to track progress and share lessons through regional platforms.
We will now hear from representatives who wish to speak on this item. And please indicate you wish to speak by clicking on the big button on your microphone. And now I call upon the representative of China to be followed by Japan.
Thank you, Mr. Chair. China has taken note of the regional office's effort to combine the Global Action Strategy Plan on Oral Health 2023-2030, Bangkok Declaration, and Regional Vision in working out the Western Pacific Draft Action Plan. We are appreciative of the emphasis on oral health by W.H.O. And based on the 3 key accelerators of oral health, China would like to share relevant experience and practices. First, China attaches great importance to oral health and continuously works on improving oral healthcare delivery system in promoting basic oral health services. First, we have standardized practices for oral health service delivery with clinical protocols and other normative documents and procedures to provide for standardization of oral healthcare. Second, we are promoting optimization of oral healthcare services across multiple dimensions. Policies have been issued to further advance the management of oral healthcare service and support setting requirements for enhancing service delivery, strengthening the supply chain management for supplies and consumables, and optimizing pricing and refining oral health insurance policies. And national promotion programs have been rolled out in China in families, schools, and communities to engage in comprehensive interventions, countermeasures against childhood oral diseases. We have leveraged the Oral Health Day and the Tooth Care Day to prevent oral health diseases and other NCD disease factors. Thirdly, in enhancing oral health governance, China integrates oral health into primary health care. Nationwide, monitoring programs have been carried out to target key populations for their oral health. And by carrying out training of primary oral health care professionals, we are strengthening grassroots service capabilities for oral health. China has taken note of the gap towards achieving our region's 2030 targets. China is ready to help the region achieve the goals, focusing on areas such as national oral health policy development, prevention, and the control of risk factors, and integrating basic oral health service into primary health care. China stands ready to promote international cooperation while working together with WHO and other regions to engage in all-dimensional and multifaceted cooperation so as to contribute China's strengths to promoting global oral health. Thank you.
Thank you. I call upon the representative of Japan to be followed by Vietnam.
Thank you, Chair. We appreciate the Secretariat's effort on the development of the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. We also express our gratitude for highlighting Japan's 80-20 campaign, where we aim to keep 20 or more teeth at the age of 80 as a good practice in the strategy. Oral health is recognized as a significant public health issue, considering its high prevalence, substantial out-of-pocket costs, and shared risk factors with other non-communicable diseases. Japan supports the importance of promoting oral health across the life course and strengthening governance for oral health as outlined in the work plan of this strategy. In Japan, oral health measures are clearly positioned in the government's annual comprehensive policy guidelines, which go beyond the health sector. This includes the utilization of evidence on the relationship between oral health and systemic health, including NCDs, and the implementation of concrete actions toward lifelong dental checkups. We would like to emphasize the importance of strong national governance in advancing oral health policies. We would also like to highlight that the degree of influence of various factors related to oral health differs depending on dietary habits, lifestyle, and medical circumstances. Therefore, it is important for each country to implement effective, efficient, and appropriate measures in accordance with national context. Lastly, Japan also has experience in bilateral technical cooperation in the field of oral health. We wish to continue sharing our knowledge and experiences to contribute to the improvement of oral health in the Western Pacific region. I thank you, Chair.
Thank you. I call upon the representative of Vietnam to be followed by New Caledonia, France.
Thank you, Chair. Reviewing the implementation plan draft, we fully agree with this draft, especially with some prioritized area for acceleration, integrating oral health into primary healthcare and universal health coverage, strengthening workforce capacity, promoting oral health through healthy setting, linking oral health with NCD preventions, and developing strong national policies as a foundation for sustained progress on oral health. Oral health in Vietnam is now working under the National Oral Health Program. The programs also prioritize on those areas with the goal and objectives is to integrate oral health into primary health care, linking clinical service with school and communities, standardize clinical process, strengthening the workforce, and accelerating digital transformation, with some main implementation activities such as community preventions with revitalized school dental programs and elderly care package, early detections of oral potentially malignant disorder at primary care, quality improvement through mentoring and teledentistry, digital health and selective adoptions of AI, and sustainable finance via state-basis leveraged by social mobilizations and partnerships. Hence, we expect by the year 2030, we will achieve our main targets, such as 100% of the students receiving oral health educations, and more than 80% of the school conducting annual dental health checkup, and over 90% of our population registered and followed for oral health. Vietnam remains committed to equitable, continuously, and people-centered oral health care that improve quality of life for all. Thank you very much.
Thank you. I call upon the representative of New Caledonia, France, to be followed by Vanuatu.
Thank you, Chair. New Caledonia thanks the Secretariat for its excellent report on the Western Pacific Region Draft Implementation Plan for the Global Strategy and Action Plan on Oral Health. In New Caledonia, the oral health situation is worrying, especially among children. We face challenges related to poor hygiene and unbalanced diets. We are monitoring this situation through a study and evaluation program and through 5-year so-called barometers of the health of youth for people aged between 10 and 18 years old and adults 18 to 65 years old. The data collected is used to improve our knowledge about health behaviors and to adjust public policies as well as to guide our prevention measures. We have an oral health program in New Caledonia and also a mobile dental van facility that offers screening services for dental caries. We also have a campaign to seal the fissures of the first molars of all 6-year-old school children, as well as for young people with disabilities. We also have a sugar tax aimed at reducing the sugar content in food products, the proceeds of which are used to implement targeted actions for the first 1,000 days in infants and for school-going children. Finally, communication is a very important driver for our preventative measures. The New Caledonia Health Agency, in charge of prevention, promotion, and education to health, is active on social media, Facebook, Instagram, TikTok, LinkedIn, and YouTube. And we also have a presence in the print media as well as radio and TV. Many materials are produced internally, such as flyers, guides, youth, and parenting tools. This approach is fully in line with the priorities of WHO, health promotion, reduction of inequalities, and strengthening of local health systems. Thank you for your attention.
Thank you. I call upon the representative of Vanuatu to be followed by Solomon Islands.
Thank you. Thank you, Chair. Distinguished delegations. Vanuatu welcomes and fully endorses the Western Pacific Regional Implementation Plan for Global Strategy and Action Plan on Oral Health. Oral health is a critical, yet often neglected aspect of public health. We commend WHO for bringing it to the forefront of the regional agenda. In August 2025, Vanuatu proudly hosted the Oral Health Pacific Islands Alliance meeting, bringing together dental practitioners and NCD focal points from across the Pacific to discuss shared priorities and strengthen collaboration on oral health. This gathering reaffirmed the importance of regional solidarity and knowledge exchange. In Vanuatu, we have made some progresses. In November 2024, we launched our National Oral Health Policy and Strategic Action Plan for 2024-2030, now embedded in the Ministry of Health Corporate Plan for 2026 to 2030. This policy aligns with the Bangkok Declaration, the global strategy, and our national priorities on primary health care and universal health coverage. We are actively implementing key components of the regional plan. The Good Fella Smile nursing training program equips nurses to deliver preventative oral health nurses to children aged 0 to 4, and our outreach services have expanded to underserved provinces. The Malo project is testing community-based oral health delivery models, and 19 dental students are currently in training to strengthen our future workforce. Oral health is now integrated into our DHIS2 health information system, and the indicators will be included in the upcoming NCD STEP survey, enhancing our ability to monitor and plan effectively. We strongly support the plan's emphasis on healthy settings and NCD integration, recognizing the shared risk factors of sugar, tobacco, and alcohol. Vanuatu is committed to embedding on oral health into broader health promotion and disease prevention strategies. Chair, this implementation plan offers a practical and inclusive roadmap for member states. Vanuatu stands ready to continue its effort, share lessons learned, and collaborate with regional partners. As the saying goes, there is no health without oral health. Thank you.
Thank you. I call upon the representative of Solomon Islands to be followed by the Republic of Palau.
Chair, fellow ministers, distinguished delegates, Solomon Islands is committed to implementing the Global Strategy and Action Plan on Oral Health 2023 to 2030 and is further committed to action the Bangkok Declaration as part of the regional vision of weaving health for families, communities, society in the Western Pacific region 2025 to 2029. In demonstrating our commitment, Solomon Islands took a pioneering role in the Western Pacific by conducting the first ever trial of the WHO Oral Health Training Toolkit for primary healthcare workers. This landmark initiative, organized by the World Health Organization Western Pacific Regional Office, marks a transformative step towards integrating essential oral health care into the foundation of universal health coverage. In our efforts to strengthening workforce capacity through training and task sharing under the initiative, local dentists in Honiara have trained primary healthcare workers from 8 Honiara City Council clinics in preventive oral health techniques early this month. The training focused on oral examination, hygiene counseling, fluoride vanish applications, sliver diamond fluoride use for caries arrest, features sealants and restorative care using glass ionomers cement, all designed for delivery in primary care setting without sophisticated equipment. It is envisaged that lessons drawn from the pilot training in Solomon Islands experience will inform the finalization of the WHO Oral Health Training Toolkit. In line with this, Chair, we are preparing the necessary requirements for the inclusion of dental medicine and preparation in the National Essential Medicine list as of 2026. This includes fluoride glass ionomers and silver diamond fluoride. Increasing dental outreach services, expanding prevention, and early screening in schools is a key priority. In progressing and implementing this priority, the National Dental Service has conducted and supervised toothbrushing program in 2 primary schools in Honiara as a model schools in our health promoting school initiative. Once this is successful, we anticipate that this initiative will roll out program to other schools around the country. Meanwhile, Solomon Island continues to do oral examination in primary schools and provide school children with free toothbrushes and toothpaste on oral health education and toothbrushing demonstration. Solomon Islands recognizes the linkage between NCD and oral health, and as such, we have integrated oral disease in Solomon Islands, non-communicable diseases, and multi-sectoral policy and roadmap 2025 to 2030. Looking ahead, we plan to conduct a national oral health survey in 2027 to provide update epidemiological data and guide evidence-based policy, strategic planning, and budgeting for oral services in the country. We request a partnership and technical support from WHO and other donor partners to support the cause and waving the mat together in oral health. Let me sincerely thank China, Japan for airing during their intervention and our partners for their willingness to support the Western Pacific region for oral health. Let us all smile with our good oral health, wave the mat, and work together in advancing our universal health coverage across our beloved Western Pacific region. I thank you, Chair. Vinaka Vakalevu.
Thank you. I call on the representative of the Republic of Palau to be followed by Malaysia.
Thank you, Chair, for the opportunity to deliver Palau's intervention on this very important topic of oral health. It is one of the most important aspects of overall health that is often overlooked yet critical in order to improve one's nutritional well-being. Palau affirms its support to the Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health, and is happy to report that despite our health workforce shortages, we have taken a simpler and more practical approach to capacity building programs for oral health. Our Division of Oral Health has partnered with the Penn Foster Dental Assistant Program to provide training on island and has just successfully completed the second cohort of dental assistants trained through a collaborative partnership with the Palau Community College. Palau finds that these simpler approaches to training current healthcare workforce is more rewarding, has a better completion rate, and helps with retention. With the ongoing challenge of healthcare workforce shortages across the region and globe, Palau encourages member states who share the same health workforce challenges to avail simpler, more practical methods for capacity building in oral health and others as well. Masulang pinakapakalebu.
Thank you. I call on the representative of Malaysia to be followed by Hong Kong Special Administrative Region, China.
Thank you, Chair. Assalamualaikum warahmatullahi wabarakatuh. Malaysia support the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health, emphasizing the integration of oral health into primary health care and universal health coverage. We highlight the importance of integrating basic oral health prevention and management into PHC to ensure accessibility for all. This truly embodies the essence of universal health care, where no one is left behind. A coordinated whole of government and whole of society approach is essential for tackling non-communicable diseases, requiring strengthened multi-sectoral governance, practical implementation tool, and sustained capacity building. Malaysia has adopted a life course approach to oral health, emphasizing promotion and prevention across all stages of life. This strategy is driven by dental therapists who focus primarily on early preventive care for specific young age groups. These focused efforts has effectively built the capacity for essential oral health intervention within the health and community workforces. We further support highlighting oral health in all aspects of daily life. Initiatives to promote oral health in school, workplaces, and cities, including healthy setting initiative, have been implemented through the school dental programs and other specific initiatives. Malaysia has shown commitments towards integrating oral health with non-communicable diseases prevention program, addressing shared risk factors, especially on sugar, tobacco, and alcohol. This integration is essential for comprehensive health improvement and support the principles of no health without oral health. In conclusion, we fully endorse the plan focusing on early intervention and shared risk factor reduction, and encourage member states to steadfast in implementing this action plan with whole of government and whole of society approach as the cornerstone for success. Thank you.
Thank you. I call upon the representative of Hong Kong Special Administrative Region, China, to be followed by the Kingdom of Tonga.
Thank you, Chair. Oral health is an integral part of our health. We commend the efforts of W.H.O and fellow member states in advancing oral health for all. Hong Kong, China is pleased to endorse the draft implementation plan for the Global Strategy and Action Plan on Oral Health. Hong Kong, China fully aligns with the plan's vision, and we have top policy commitment to achieve oral health for all. For over 60 years, we have implemented water fluoridation, which is a cornerstone for public oral health. And for over 40 years, we have provided free annual dental checkup and essential dental care for all the primary school children. In recent years, we embarked on a number of new major initiatives. First, to further integrate oral health into primary health care, we have incorporated oral health assessment into our maternal and child health centers for the infants and preschoolers, helping to cultivate early positive oral health habits. Second, to further prioritize prevention through our life course, we have further expanded subsidized dental care with public-private partnership to have dental support and management for adolescents up to age of 18 years in order for them to foster good dental checkup habits. Third, for emergency dental treatment, they are provided free for all the citizens of all ages. Fourth, for elderly living in residential care homes, we are expanding the free outreach community dental services. And fifth, to strengthen our oral health workforce capacity, we have established a robust legislation and registration system covering dentists and also paradental professionals like dental hygienists and dental therapists. And additionally, our electronic health record system now covering around 6 million out of 7.5 million population, and as well as the regular oral health surveys enable us to collect up-to-date and representative oral health status for our citizens. Sixth, we should not forget the needs of the underprivileged groups and those vulnerable groups such as those children with mental health needs. As such, we have targeted community dental support programs to allow them to access to essential preventive and curative care. Seventh, which is also very important, we are now incorporating those prevention as well as promotion strategies into our NCD effort. So Hong Kong, China stands ready to work closely with W.H.O and fellow member states. We aim to drive progress towards oral health for all. I thank you, Chair.
Thank you. I now call upon the representative of the Kingdom of Tonga to be followed by the Republic of Korea.
Thank you, Chair. Tonga faces significant oral health challenges with rising dental diseases linked to dietary changes and limited access to hygiene products. The country's geography and economic situation make healthcare access difficult, especially for children who comprise 35% of the population. The Mali Mali program, which is SMILE in English, since 1998, the Mali Mali program has been a pioneering school-based initiative improving oral health among children and later expanding to adults and the wider community. The program focuses on weekly teacher training, fluoride use, and community engagement through workshops and festivals. Success has been driven by regular workshops, standardized education materials, and broad promotion via media and government channels. The program adapts to evidence, introduces fluoride and silver fluoride treatments to reduce cost and improve outcomes. Since its inception, the Mali Mali program has achieved remarkable progress. Enrollment increased from just 0.3% in 1999 to 99% by 2019. While dental caries rates fell dramatically from 90% to 46.9% among children aged 1 to 9 and 35.2% among people over 5 years old. Today, nearly all primary schools participate, and the program's reach now extend to adults, fostering lifelong oral health and stronger communities. A significant milestone has been the transition of full management by Tongan staff, supported by ongoing training and capacity building. As of 2025, the Ministry of Health, W.H.O and CHICA provide crucial support enabling expansion to the main outer islands and all primary schools in Tongatapu. These achievements underscore the power of local leadership, evidence-based adaptation, and cross-sector collaboration. Looking ahead, sustained investment and innovation will be vital to further reduce oral health disparities and ensure every Tongan can benefit from a healthy smile. In conclusion, the Mali Mali program stands as a model of sustainable, community-driven oral health intervention, demonstrating measurable improvements and broad participation. Its success highlights the importance of local leadership, evidence-based adaptation, and collaboration across sectors. Thank you so much. Malo.
Thank you. I call on the representative of the Republic of Korea to be followed by France.
Thank you, Chair. Korea welcomes and supports the draft of Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. This implementation plan makes it clear that the oral health is not just about some issue with your teeth, but it is an essential part of overall health and well-being. We particularly agree with the acceleration programs of integrating oral health services into PHC and UHC and integrating oral health into NDC prevention programs. With population aging, which is an issue that our region as a whole is facing, promoting oral health across the life course is not an option anymore, but a must. In response to the global trend, Korea has also steadily advanced its oral health policies. Korea has established the second basic plan for oral health project from 2022 to 2026 and concentrated its policy efforts in prevention-centered management and bridging the oral health disparities, with the aim of realizing oral health for all people's healthy and happy life. This basic plan is focused on raising the accessibility of essential oral health services within the universal health coverage system. We have developed the service taking into account of the life course and started a pilot program on helping children to grow into a habit of caring oral health of their own from the early ages, and have provided monetary support for elderly people aged 65 and older for their implants and dentures. Also, in order to further enhance the accessibility of oral health services for people in vulnerable groups who are prone to being left out, we launched a pilot project on oral health management visits for elderly people with less mobility, and we will continue to reinforce the policy support to make sure that all people receive the professional dental care when they need it by operating oral care centers for people with disability by region in the country. This is in line with the shared goal of the Western Pacific that aims to eradicate health inequity. Korea will continue to closely cooperate with the member countries for the adoption of Western Pacific Regional Implementation Plan and its successful implementation. We hope our policy experience contributes to promoting oral health of the Western Pacific region. Thank you.
Thank you. I call upon the representative of France, maybe Cambodia.
Thank you, Chair. Regional Director, Honourable Ministers, dear colleagues, oral health is particularly important for the people, the health of everyone. It has been neglected for too long, and it is now a central issue in our international debates. And that is exactly what we are doing here. Since the adoption of the resolution on oral health that was adopted at the 74th World Health Assembly in 2021, the international momentum has accelerated. The Global Action Plan for Oral Health 2023-2030 provides an ambitious and structured framework. The Bangkok Summit of 2024 reaffirmed the commitment of states, including France, to strengthen synergies between oral health and NCDs. The May 2023 World Health Assembly marked a turning point by highlighting the links existing between oral health and NCDs and by calling for a better integration of oral health in public health policies. In France, we have decided to go even further. In 2025, we launched a strategic reflection to draft an oral health roadmap. This strategy aims at reducing social inequalities when it comes to health by targeting the most vulnerable populations: pregnant women, infants, children, young adults. It marks sugar as a major determinant of oral health and is linked to our nutrition strategy, which has been led since 2001 by the National Nutrition and Health Programme. Thanks to this programme, we have concrete progress we can boast about: a reduction in sugar consumption amongst young people, stabilized prevalence of obesity, and improvement in feeding behavior or in nutrition behavior. One of the main measures include a tax on sugary drink, which was further enforced in 2025. In French Polynesia, we have set up a very ambitious program in 1970 with education, screening, and care measures for all children. And it also targets vulnerable people, such as patients with rheumatic fever and heart disease. This program can be shared with other countries that could be interested. We are convinced that prevention is the most powerful enabler. Oral health needs to be fully integrated into NCD policies because It is an indicator of social justice, it is an enabler for achieving better well-being, and it is a pillar for global health. France supports regional efforts, particularly in the Western Pacific, and we actively contribute to promoting a holistic and equitable approach to oral health. Thank you very much.
Thank you. Call upon the representative of Philippines, to be followed by Fiji.
Honorable Chair, Excellency, ladies and gentlemen, Cambodia has brought public oral health program to meet people need, while its intervention in public health care cover countrywide. The prevalence of untreated caries of diseases in children from 1 to 9 years old is 45.5%, and Cambodia prevalent untreated caries of permanentis in people aged 5 years or more is more than 31%, according to the WHO estimation 2019. The distribution of oral health workforce is not yet optimal, and there is a gap between the existing oral health workforce and service structure. Early childhood and dental care among primary school children, emerging need of all adults within the population, cancerous and precancerous oral musical lesions are main cause in the field of oral health intervention in the country. To attain oral health universal coverage, Cambodia launched National Action Plan for Oral Health 2023-2030. Oral health is integrated into National School Health Program 2021-2030. Oral health screening, silver diamond fluoride application has been conducted for preschool and primary school children. Develop and distribute oral health education material to different levels of education system. The development of appropriate care pathway to deliver oral health services for all the adults and provide oral health care training on essential package of care for health professionals. Cambodia supports the draft resolution of oral health and look forward to working closely with the WHO, fellow member states, development partners, and private sector toward universal access to oral health care. I thank you, Chair.
Thank you, Cambodia, and sincere apologies for that mishap in terms of the listing here. So we will now move on to U.S. territory, and then to be followed by PNG.
Thank you, Chair and distinguished delegates. The U.S. territories support the Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health, commit to its promising goals, and thank you for the opportunity to address oral health among our island communities. Our territories face the challenges that mirror those across the region. With many in our populace affected by preventable oral diseases, we recognize the urgent need for action and commitment. Oral cancer is also a significant concern, with high incidence and growing mortality rates linked to late diagnosis, especially true among our young adults in the CNMI. Geographic isolation, workforce shortages, and limited access to care, combined with persistent risk determinants, create a perfect storm for oral disease, especially among our most vulnerable island communities. The U.S. territories are taking concrete steps aligned with the regional plan's acceleration projects. First, we continue to work to build community health worker programs to include oral health training, enabling basic preventive services in areas where dental professionals are scarce. Our partnerships with post-secondary nursing and other health programs now include oral health modules in their curriculum. This parallels Project A's workforce capacity building. We are working diligently to integrate oral health into our primary care systems. Following successful models across sister islands of the Pacific, we in the CNMI aim to train population health professionals to conduct basic oral health screenings and cessation counseling during immunization, wellness, and other routine visits. Mobile clinics movement across villages that consistently weave oral health and primary care access have made valuable progress in providing care to underserved areas, access to services and screenings. We will continue these pursuits. Last, we are strengthening policy foundations, developing comprehensive oral health strategies that involve traditional leaders to support our NCD plans. We have also recognized the need for and achieved mandated warnings of shared risk factors of sugar and alcohol consumption, tobacco use, and betel nut chewing that link oral health realities with diabetes, cardiovascular disease, and oral cancer, conditions disproportionately affecting our Pacific Islanders too. We also continue to advocate for the inclusion of essential oral health services for adults in our Medicaid state plan amendments and initiatives to mitigate the consequences of few options for insurance, particularly with benefits for adults being minimal or totally absent in certain areas. The U.S. territories appreciate the opportunity to express strong support for WHO W.H.O efforts and toward continued and practical multi-sectoral support on oral health. Thank you.
I'll call upon the representative of Papua New Guinea to be followed by the Philippines.
Thank you, Chair. Honorable Ministers, Regional Director, Excellencies, ladies and gentlemen. Papua New Guinea aligns itself with the WHO Western Pacific region's vision of weaving health for families, communities, and societies, and commends the Secretariat for its continued leadership in advancing the regional oral health agenda. We welcome the progress achieved under the Regional Action Plan on Oral Health and reaffirm our commitment to implementing its key priorities within our network. Chair, oral health is an essential part of overall well-being and a critical indicator of health equity. In recognition of this, the government of Papua New Guinea has prioritized the strengthening of oral health services and systems at all levels. I'm pleased to inform this General Committee that the National Oral Health Policy has been drafted and it's now at its final stage of government endorsement. This landmark policy will provide the strategic directions to guide all oral health programs, align national standards with global best practices, and ensure equitable access to quality oral health services for our people. Equally important, Papua New Guinea continues to promote oral health at the community and school levels through our National School Health Policy and Program. Components of oral health and hygiene education have been integrated into school curricula, fostering healthy habits and preventive practices among children from an early age. This approach underscores our commitment to prevention as the cornerstone of sustainable health improvement. To strengthen clinical capacity and service delivery, the government will soon establish an oral health center of excellence at the Port Moresby General Hospital, our national referral institution. This center will serve as a hub for advanced care, professional training, and research, supporting national efforts to enhance oral health standards and promote innovations in clinical practice. Furthermore, Papua New Guinea is investing in the future oral health workforce. The establishment of a standalone medical university, approved to commence next year, will expand the training pipeline for oral health professionals, including dentists, dental therapists, and oral health specialists. This reform represents a major step forward in ensuring a competent, sustainable, and nationally driven health workforce. Finally, in conclusion, Chair, Papua New Guinea reaffirms its strong commitment to strengthening oral health systems, improving access to essential services, and integrating oral health into primary health care. We recognize that progress in oral health contributes directly to broader health, social, and economic outcomes, and we remain steadfast in pursuing these goals in partnership with WHO and our regional and development partners. Together, through sustained collaboration and shared commitment, we can ensure that oral health remains central to the regional and global health agenda, promoting not only healthy smiles, but healthier, more resilient communities. Thank you, Chair.
Thank you, and I call upon the representative of Philippines to be followed by Fiji.
Thank you, Chair. The Philippines expresses its strong support for the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. We recognize oral health as a fundamental component of universal health coverage and overall health and well-being. First, under Acceleration Project B, on integrating oral health into primary health care and UHC, the Philippines is implementing Republic Act No. 1123, or the UHC Act, to strengthen the integration of essential oral health services at the primary care level. The Omnibus Health Guidelines adopt a life course approach to ensure accessibility and continuity of care. In 2024, the Philippine Health Insurance Corporation expanded its benefit package to include preventive oral health services. The Department of Health procures and distributes fluoride varnish, glass ionomer sealants, and silver diamine fluoride nationwide. In line with the Minamata Convention on Mercury, the country successfully completed the phase-out of dental amalgam in 2023. Second, under Acceleration Project C on healthy settings, oral health is embedded in the DOH Health Promotion Framework Strategy 2021 to 2030 through healthy schools, workplaces, and communities. The Healthy Learning Institutions campaign with the Department of Education integrates oral health promotion in school-based initiatives complemented by maternal, adolescent, and workplace health programs. Third, under Acceleration Project D on NCD prevention, Republic Act No. 10963 introduced excise taxes on sugar-sweetened beverages, while Republic Act No. 1148 integrates oral health and nutrition interventions during the first 1,000 days of life. Lastly, under Acceleration Project E on governance, proposed legislation seeks to institutionalize oral health under UHC. The National Oral Health Survey will provide updated epidemiological data to guide policy. The DOH, in partnership with the World Health Organization, is developing the National Oral Health Strategic Framework to align national directions with global and regional commitments. The Philippines fully endorses the draft implementation plan and reaffirms its commitment to advancing oral health as an essential component of UHC and resilient health systems. Thank you.
Thank you, and I call upon the representative of Fiji to be followed by Marshall Islands.
Thank you, Honorable Chair, distinguished Regional Director, Excellencies, and fellow delegates. Sambulo Binaka, good afternoon, and a warm greeting from the Fiji delegations. Fiji commends the Secretariat and the Regional Director for the comprehensive report and for bringing oral health to the forefront of the 76th Regional Committee agenda. As the RDS reminded us, oral health has long been neglected, yet it is fundamental to overall health and well-being. Across our region, more than 800 million, or 40% of our population, live with oral health diseases that are largely preventable. These conditions share the same risk factors as other non-communicable diseases such as diabetes, cancer, and cardiovascular disease. But investment in oral health remain limited. In Fiji, the burden is significant. The prevalence of untreated dental caries among Fijian children aged 1 to 9 years old is at 46.7%, while lips and oral cancer account to 2.9% of all cancer in our Ministry of Health and Medical Services registry, affecting more men than women. These figures highlight the urgent need to strengthen prevention and integrate oral health into primary health care and universal health coverage. We are taking decisive steps Through our 23 school oral health teams, we reached out to 158,000 children in 2024 and conducted oral health education and toothbrushing drills in school. Our Healthy 520 Smile initiative motivates preschoolers to keep 20 healthy milk teeth at the age of 5. And last year, 2,278 children proudly received the Embula Smile certificates. We also mark World Oral Health Day every March with community, schools, and partners to promote lifelong habits for good hygiene, low sugar diet, and regular dental checkup. We are strengthening our system through the appointment of the National Advisor for Oral Health, upgrading of dental equipment, and also postgraduate programs at the Fiji National University. Since 2014, the Fiji National University has produced 15 oral surgeons with master level qualification from Fiji, and they are now serving across the Pacific regions, including Solomon Islands, Vanuatu, Samoa, Tonga, Nauru, American Samoa, Cook Islands, and the Marshall Islands. This capacity building initiative has significantly improved the quality and accessibility of specialist oral surgery services to our Pacific populations. Fiji recommends to WHO and development partners to continue to support these regional efforts. This regional training model is a Pacific success story that build capacity and equity across our island nations. Chair, Fiji has also implemented an innovative public-private partnership to improve access and reduce pressure on the public sector. Under this arrangement, Fijians registered under the Social Welfare and Free Medicine Scheme can now receive selected free dental care from private dental practitioners who are enrolled in the program. This initiative improves accessibility for vulnerable populations, enhance service efficiency, and demonstrate how partnership can bridge service gaps while advancing universal health coverage. Fiji is now preparing a national oral health survey to better define our status and inform our next phase of policy and strategic evidence-based intervention in moving forward. Chair, Fiji fully endorses the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health 2023 to 2030. We support its priorities, integrating oral health into primary health care, linking it with NCD prevention, strengthening the workforce, and promoting healthy settings through strong national policies. Let us work together to ensure that oral health is no longer treated as separate from general health, but as a gateway to dignity, confidence, and quality of life for every person in our region. Now, Valev, and I thank you, Chair, for this opportunity.
Thank you, Fiji, though you went 2 minutes too far. But I now call upon the representative of Marshall Islands to be followed by the Federated States of Micronesia.
Thank you, Chair. Honorable Chair, Ministers, Regional Director, distinguished delegates, oral health is more than teeth. It's central to the health, well-being, and future of our communities. Yet, in the Western Pacific region, over 800 million people suffer from preventable oral diseases. These conditions share risk factor with diabetes, cancer, and cardiovascular disease, highlighting the importance of integrated action. The Marshall Islands strongly welcomes the draft Western Pacific Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. It provides practical guidance to integrate oral health in primary care, strengthen our workforce, promote healthy settings, and develop policies that ensure sustainable progress. At home, we're taking action to ensure no community is left behind. Through our early childhood development programs, oral health is now a core requirement for new pregnant mothers, ensuring the next generation begins life with strong foundation. We have expanded school-based prevention programs informed by our recent hybrid survey, which identify key gaps in access and high-risk populations. We are also linking this effort to services for neighboring islands using mobile and outreach programs to reach children and families in remote communities. By strengthening primary care, supporting community prevention, and addressing shared risk factors such as sugar, tobacco, and alcohol, we are improving nutrition, well-being, and quality of life for all. This plan emphasizes early intervention, smart use of existing services, and regional collaboration. By learning from one another and aligning action with national priorities, countries can build stronger oral health system and reduce preventable disease. The Marshall Islands fully support this implementation plan. Together, we can ensure healthier communities, protect future generations, and advance the vision of the WHO for better health and well-being for all. I thank you, Chair.
Thank you, Marshall Islands. Now, call upon the representative of the Federated States of Micronesia. Honorable Chair, Honorable Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. Kasalelia Mango, Raranim, Mokathin, and Lanwo and Nisam Bulavinaka. The Federal State of Micronesia commends the initiative already undertaken by the regional members. Oral health is covered under Priority Area 5, Health through the Life's Course from Womb to Tomb in the Federal State of Micronesia Health Framework 2024 to 2034, which aims to reduce morbidity and mortality while promoting overall well health. FSM has adopted an innovative approach to oral cancer diagnosis through telepathology, enabling diagnosis from Japan. This approach focuses on making service readily available and affordable to the communities with more efficient turnaround time for cancer diagnosis and, most importantly, treatment. This technology has significantly reduced diagnosis waiting time from 2 to 6 weeks down to 3 days. Oral health care has long been priority for FSM. We aim to revitalize the National Medical and Dental Association and establish both a national oral health program and a comprehensive national policy for oral health, aligned with the World Oral Health Strategy and Action Plan. The program will also support in-country training initiatives and work to standardize monitoring and reporting process. In line with regional priorities area, FSM is enhancing population access to comprehensive family health and life course, cross-cutting services such as behavioral health, oral health, maternal and child health, eye health, and non-communicable disease programs. We intend to adopt a life cycle approach guided by evidence-based policies and best international practice tailored to our national context. These include updating standard operating procedures across all levels of care, strengthening community education, awareness, and reinforcing monitoring supervision system. Collaboration with education and youth sector will be essential to raise awareness and promote oral health within communities. Active involvement and engagement of communities at every level will remain a central focus.
FSM remain fully committed to adopting and achieving all priority areas related to oral health. Vinakavakalevu, Kalangan, Kamagar, and Hilso Chapur. Thank you.
Thank you very much, United States of Micronesia, and I sincerely thank and appreciate all the interventions that have been highlighted in this agenda. And I believe no one is more, I believe our RD really holds oral health close to his heart. And that is why I'm very, very grateful that this is in the agenda. If there are there any other more representatives who wish to speak on this topic? And if not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. And it is my pleasure to ask the representatives of the World Dental Federation and International Association for Dental Research to deliver a constituency statement to the regional committee.
FDI, World Dental Federation, representing over 1 million dentists worldwide, and the International Association for Dental, Oral, and Craniofacial Research, representing over 10,000 researchers, thank the Chair for this opportunity. We applaud Member States for their commitment to stronger action on oral health, globally, including at the recently concluded 4th United Nations High-Level Meeting on NCDs and Mental Health, and regionally. We welcome the draft implementation plan with its 3 priorities and 5 acceleration projects backed by targets and indicators. The 2025 baseline estimates for targets included in the implementation plan provide valuable insights into progress achieved and highlight areas where urgent action is needed. We urge Member States to allocate the budgetary and human resources required to translate their commitments into measurable impact. The implementation plan emphasizes addressing risk factors for oral diseases and NCDs. We strongly recommend revising the regional target for policy measures on free sugar intakes upwards to 50% of countries from 37% to better address the heavy burden of untreated dental caries. We support expanding access to essential oral health services, including integration into primary healthcare services and strengthening monitoring and evaluation. The baseline report of WHO Global Oral Health Plan cautions that just 6% of member states globally report having a monitoring framework for their national oral health policy. Additionally, only 3% of the regional population have access to essential oral health services. We urge member states to integrate oral health into universal health coverage plans and strengthen oral health research to track progress toward national, regional, and global targets. Also, research is urgently needed to evaluate scalable models of PHC interrogation, sustainable financing mechanisms, culturally adapted community engagement strategies. FDI and IADR stand ready to support member states and partners in implementing these measures. Thank you, Chair, and happy Diwali to everybody.
Happy Diwali as well. And may I now call on the representative of Global Self-Care Foundation to deliver the next statement to the regional committee.
Thank you, Chair. GSCF aligns with the Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health and commends Western Pacific member states for their leadership implementation of oral health initiatives. Oral diseases are the most prevalent NCD worldwide and affect over 800 million individuals in the W.H.O region alone. Oral diseases are also linked to other major NCDs such as diabetes, cardiovascular disease, and certain forms of cancer. Oral health self-care, or their daily behaviours, routines and products individuals can adopt to improve and maintain their oral health represents an opportunity to tackle common NCD risk factors and prevent major oral diseases such as periodontitis. Through engagement since the 2024 Bangkok meeting on oral health and advocacy led at the 2025 W.H.O, W.H.O played a significant role in having oral health fully embedded in the 2025 Political Declaration on NCDs and mental health. Building on these commitments, and in the lead up to the 2027 HLM on universal health coverage, GSCF calls on member states and global stakeholders to 1. Affirm the importance of action to reduce the prevalence of oral diseases globally within the context of NCDs and universal health coverage. 2. Recognise the vital role of oral health self-care in reducing the incidence of periodontal diseases within the context of NCDs. 3. Embed good oral hygiene as a foundation of UHC frameworks. Thank you.
Thank you for that statement as well. Thank you very much. And may I now call on the Secretariat to respond to the points that have been made.
Yes. Yes, thank you very much, Chair. I'd like to thank all the Member States for your thoughtful interventions and continued commitment for oral health. We also appreciate your strong support for the Regional Implementation Plan for the Global Strategy and Action Plan on Oral Health. We welcome so many countries, including Cambodia, China, Hong Kong, SAR, Japan, Republic of Korea, Vietnam, Cambodia, Malaysia, New Caledonia, Papua New Guinea, and the Philippines and Vanuatu, have developed national plans and policies that integrate oral health into existing systems, such as primary care, capacity building of healthcare workers, reach out to the remote population, school health, and leverage digital health tools such as AI to improve equitable access. In particular, we appreciate the Solomon Islands for the first time field testing of the WHO primary care oral health training toolkit to embed oral health into the primary care. We also recognize the Philippines has included the preventive oral health services in its national insurance program. And we note the focus of several countries, including federal state of Micronesia, Fiji, Marshall Islands, Palau, and Papua New Guinea, and US territories, on building the capacity of primary care workers. In addition, we commend France, Malaysia, and New Caledonia efforts, including tobacco control, sugar taxes, nutrition labeling, and then other health promotion campaigns. Japan's 80-20 campaign, Tonga's Marimari project, Vanuatu's community-based approach are all successful examples of cross-sectoral and lifelong health promotion. Finally, we also noted that member states' effort, including China, Hong Kong SAR, and Vanuatu, to integrate oral health into national health surveys and information systems to strengthen data-driven and equitable decision-making. We also welcome and appreciate that member states reaffirmed their commitment to share experiences and cooperate regionally. Knowledge exchange between US territories and neighboring islands serves as a great example of such a successful collaboration. The Secretariat will also facilitate knowledge exchange and technical cooperation going forward. And in future, we look forward to working closely with you, Member States, to facilitate the implementation of a global action plan, specifically implementing the regional oral health plan through technical guidance, collaboration, knowledge exchange, and regular progress reporting. As Papua New Guinea and Fiji delegation mentioned, oral health is a critical indicator of well-being, dignity, and health equity. So together, we can ensure that oral health is no longer neglected, but a core component within primary healthcare, health promotion, and capacity building effort, so that everybody can eat, speak, and smile for their lifetime. Thank you very much.
Thank you, Dr. Kayashu. There are no further comments. May I request the rapporteurs to draft an appropriate resolution. And that concludes our consideration of this agenda item, and I thank you very much. We have now reached the end of today's session. We will now suspend this item and reconvene. I will reconvene tomorrow at 9 a.m. in the morning. And I would like to invite the Director of Administration, Finance, Dr. Thomas, to remind us of the details. Thank you very much, and see you tomorrow.
Thank you, Mr. Chair. Just a quick announcement. So immediately after this plenary session, as announced earlier, we will have an informal consultation with member states, also known as the caucus, in this plenary hall. But as you know, this caucus is attended by the chief representatives and up to one of the alternates of the member states with the seats of government in the region. We'd like to ask that all other colleagues and participants vacate the hall immediately following the adjournment of the plenary. And you will have, of course, transportation provided back to your homes. The rapporteurs meeting, as every day, it will be held, this time not in the Reva room, but in the room just beside the Reva room on the right. And as Honorable Chair said, tomorrow at 9 a.m. we reconvene. Transportation will be provided back to the venue in the morning. Thank you very much. Vinaka Vakanil.